Hey everyone, it's Jordan. I'm back. It's been a long time since my last video, but I'll be making videos more regularly as of today. Today is Sunday, March 15th, 2020. We are unfortunately in the middle of a global pandemic, which has prompted me to share this video so that I can share information with fellow Uber drivers about the protocols around COVID-19. So I hope that this video is informative, and I'll be updating it as well. I'll be updating the text section as more information rolls in. So the information that I share today is accurate as of Sunday, March 15th, 2020. Today I'm going to be talking about the compensation Uber is offering to drivers if you've been found positive for COVID-19, or if you have documentation saying that you have been exposed to COVID-19 and have been ordered to be under self-isolation. I'm from Toronto, so most of the information that I'll be providing is Ontario specific. Some of the information I'll be providing will be Canada-wide, but if you are an Uber driver from another province across Canada, then the logistics around who you would call or where and how you would get testing done would be applicable to your province's health system. Now, Uber has offered compensation to drivers for up to 14 days, but to be eligible for that, you have to go through a bunch of documentation. What Ontario and what Canada is saying is don't go into a hospital or don't go to a doctor's office or a health clinic if you feel like you've been exposed to the COVID virus. Instead, it's better to do a test online or to do it over the phone because you don't want to put the other patients in the waiting room at risk, and you also don't want to put the doctors and healthcare workers at risk. I know that the virus is asymptomatic, which means that it can be asymptomatic, which means that there might be no symptoms at all. But if you feel like you're experiencing symptoms for COVID-19, which I'll get to at the end of the video, the best thing is to start with online or to start with on the phone assessments with a doctor or healthcare provider. So across Canada, the number that you can call is 811, and in Ontario, what you can call is telehealth. Telehealth is 1-866-797-0000. There are some existing resources where you can speak to a healthcare provider online across Canada or specific to your province. Some of those examples are Medio Virtual Care, Maple, Babylon Health, and MedHouse Call. Ontario and Quebec are currently trying to roll out a specific to COVID-19 online database where you can speak to a healthcare provider. And I'm pretty sure that British Columbia is going to follow suit, ASAP as well. So please keep listening to the news for any of those updates. And as I hear them, then I'll also update that in the description. Ontario is also working on COVID-19 assessment centers where you can be able to go in to see a healthcare provider in person, but also be away from people who are in the healthcare system, like at the hospital or at the doctor's office, who are there for non-COVID-19 related reasons. So if you are experiencing symptoms of COVID-19, or if you have been exposed to somebody who's been confirmed with COVID-19, then please don't go to your doctor's office or to the hospital. Please start with calling either 811 or telehealth, or as they roll out, speaking to an online physician, or also as they roll out, visiting a COVID-19 specific assessment center. The documentation that Uber needs to be able to compensate you if you are an Uber driver who has been unfortunately diagnosed with COVID-19, or if you've been officially put under quarantine, has to come from a medical health official. So, for example, if you come back from a country that has lots of cases of COVID-19, including the United States, if you come back from one of those countries that has a lot of COVID-19 cases as of right now, the CBSA is going to put you under 14-day quarantine, self-isolation. That statement, or if they give you a piece of paper telling you that you have to self-quarantine, is not what Uber needs. You have to get the documentation specifically from a health official. So that would be calling and helping them tell you what to do next, whether they send you a test, whether it comes back positive or negative, and what to do next, or speaking to somebody online. It has to come from a health official specifically. Now, once you have your documentation saying that you've been diagnosed with COVID-19 or have been officially ordered under quarantine or under self-isolation from a health official related to COVID-19, once you have the documentation, then you need to send that in to the law enforcement response portal. That is what Uber will need to begin initiating your documentation. The law enforcement response portal can be found at www.lert.uber.com. They are going to request evidence of your health status, and based on that, Uber is going to make a determination of how they're going to compensate you up to 14 days. So that will be based on the outcomes of your health status, whether you have been diagnosed or whether you've been exposed to COVID-19, and they'll make a determination based on how long they're going to pay you and what they're going to pay you. I wasn't able to get a clear answer from the Uber representatives what the basis around payment is, whether they are looking at the average of how much you have worked for over the past 2 weeks or over the past month. They didn't give me a determination on that. They said that it's based loosely around income, but it's mostly based around the outcome of the health status. COVID-19 can be asymptomatic, which means that you don't show any symptoms, but if you do show symptoms, some of those can include, but are not limited to, fever, new cough, difficulty breathing, muscle aches, tiredness, sore throat, runny nose, and diarrhea. If you need more information, you can visit ontario.ca or publichealthontario.ca, where they're able to offer a bunch of different information and resources over a range of different languages. I know this may be a scary time right now, but we're going to get through this, and we're going to get through this together. I hope you found this video informative. If you did, please subscribe to my channel so you can get more content. I'm going to be releasing my next video, which is going to be based around the cleaning supplies that I use to keep my car clean on a regular basis, but which are also extremely more effective during this pandemic that we're in. So if you have these supplies, or if you're able to get these supplies, then I'll be sharing that in the next video about how you can keep your car clean on a regular basis, but also especially during this pandemic. Please give this video a thumbs up if this information was useful to you. Please also share it so other Uber drivers can have access to this information. I wish you all safety and solidarity during this pandemic and beyond. Please remember to continue washing your hands. Don't touch your eyes, your nose, or your mouth without washing your hands. Please try to sanitize all surfaces as much as you can if you have access to these supplies, and keep a safe distance where you can, and also practice self-isolation if you're able to do that. Proactive is the best measure. I wish you all the best, and I'll catch you in the next video.